This lecture is the history of exercise in physical therapy. So starting at 1000 BC, our Taoist priests in China developed Kung Fu for pain relief. And the reason we know this is because of the writings that they completed about their therapeutic exercise. And their writings described body positioning and different breathing routines. Moving up to 500 BC, the Greeks. Herodotus was a Greek physician who wrote the Ars of Gymnastica, which is the art of gymnastics. This writing was a very elaborate description of exercises. He believed that exercises were good to treat febrile conditions, so conditions with fever. His recommendation for exercise, however, was wrestling, walking, and massage. Walking wasn't walking around the block, it was more like walking up to 20 miles. And the Greeks use different types of equipment. They use halters, which resemble dumbbells, and they use horse-drawn carriages. So they would have basically people sit in horse-drawn carriages, and while going over bumpy roads, this would work on strengthening and stabilization of different exercises. Moving to 400 BC, Hippocrates, he was thought to have been mentored by Herodotus. However, Hippocrates is actually considered the father of medicine because the Hippocratic Oath actually is named from him. So he was the first physician to prescribe exercise to combat atrophy of muscle, which was kind of a unique belief back then. And he believed very strongly in medicine as science and rather than religion, which was common thought back then. He used electrical stimulation through the use of torpedo fish, so he would use that electrical charge to treat headaches. He would also prescribe massage oil and recommend patients drink water if they felt fatigued. Moving to 180 BC with the Romans adopted their own form of therapeutic exercise from gymnastics from the Greeks. And they would use it with their athletes, which were the Roman gladiators back then. So they would participate in exercises to strengthen and prepare for their fights as gladiators. An important Roman at the time was Galen, who was a renowned physician back then. He was the expert on surgical trauma and musculoskeletal types of injuries. He was a strong believer in strengthening exercises to heal. He was an advocate for increasing body temperature to allow the pores to open, not only to heal physiologically, but to also improve spiritual well-being. He was also one of the first people to, what we know as kinesiology and physiology, describe this in different types of writing. He was kind of one of the first people to realize that each muscle that contracted had an antagonist type of muscle that did the opposite action on the other side of the joint. So he was the first to really discuss how all of our muscles and our movements are interconnected rather than being independent. We're going to look a little bit earlier from the 1940s to the 1900s in Europe. So in the 1940s, physical education started to be introduced to the school system because of the importance of being active and with the young population. In the 1500s, the first book of exercises was printed. And then in the 1700s in England, Nicholas André, he was a very popular orthopedic physician who believed in exercise to cure a lot of diseases and injuries. He was kind of the first one to really implement some of these exercises to improve the musculoskeletal system. He also believed in massage, hydrotherapy, I mentioned exercise, and he also believed in using exercise equipment. Because of that, the people that followed after developed a lot of different machines to perform exercise. So Henrik Ling, he developed a series of exercises known as Swedish exercise, or again, gymnastics or different types of movement. This was both an active and a passive motion. He believed in a lot of personal training type of gymnastics movements and exercises as well. So there's a very common theme over time from our Greeks all the way up to our 1800s in Europe. The U.S. was a little behind in implementing physical education in school, but this occurred in the 1800s. In 1860, electrical stimulation was introduced into the United States. This image on the right here shows electrical stimulation. The image on the left is diathermy. So this came about in 1890 by Nikola Tesla. He introduced this into the medical field, and this allows for deep heating and improved circulation. So these coils here you can see, you would wrap them around the joint and then back to the machine, and that would provide a deep heating to improve circulation. Looking at the 1900s, we had talked in our previous lecture about reconstruction aids. Gustav Zander developed the machines that you see here in 1864. They're different type of machines to assist movement or resist movement, as well as Henrik Ling's types of movements. That was all combined to complete exercises and movement and treatment for rehabilitation for disabled soldiers from the war. Looking at a different type of exercise, Pilates was developed from Joseph Pilates himself. He was originally born in Germany, but was very sick as a child. He had rickets, rheumatic fever, and asthma. Because of that, he really dedicated his life to improving his own health and physical condition. And the exercises that he developed, he ended up using springs to provide resistance to the movement pattern. So he would use bed springs for the resistance, and that would be used with soldiers to help improve strengthening that way. The Pilates method has also been referred to as contrology. There's several different types of Pilates methods these days, so there's different variations on Pilates. But the basic principles are to focus on breath, alignment, postural control, precision of movement, flexibility within the movement, as well as a controlled flow through the phases. Joseph Pilates moved to New York and opened a Pilates studio in 1925. As you can imagine, this became very popular within the professional dance world. Here are just a couple of images of Joseph Pilates working with individuals doing different types of exercises and movement patterns. Moving back to England real quick in the 1900s, I bring these up because you're going to see some of these techniques in some of your other classes. Dr. Herman Cabot developed proprioceptive neuromuscular facilitation, or PNF. This is a type of treatment technique that was initially used in patients with a lot of neurological types of conditions. So patients with cerebral palsy or patients that have had a cerebrovascular accident or a stroke. You'll see nowadays that PNF techniques are used in a variety of patient populations. Frankel's exercises, these were used for ataxic gait, which is a very unstable gait, and it consisted of a series of planned exercises that were designed to help compensate for weaknesses or the inability to move certain parts of the body. These are very slow, repetitive types of movements. So some of the things that patients would do is they would watch a body part move and then try to correct the pattern. So they would give themselves their own feedback on their movement patterns. In the 1900s in the US, we've talked about this a little bit in our other PowerPoint slide, but just to reiterate, therapeutic exercise was becoming much more popular among rehab specialists, so PTs, physicians, physiatrists, other scientists. In 1916, Robert Lovett was a professor of orthopedic surgery at Harvard. He really focused on muscle training for treatment of patients with polio, and we talked about that in the last lecture, about how strengthening became a focus for polio patients. We also talked about Wright being Lovett's senior assistant. He was the one that developed manual muscle testing, so looking for areas of weakness and then developing exercises to treat those areas of weakness. A few other important things that were developed in the 1900s. So Charles Lohman developed hydrogymnastics, which essentially was getting patients into pools of water and would do exercises with them in the water. And this was done initially for patients with polio. This is essentially what our aquatic therapy is today. Carl Hubbard was an American engineer, and he developed the Hubbard tank, which again was just a large pool or a tub of water that patients would be able to get into and be fully submerged. These were first installed in hospitals in the 1900s. X-rays were used for treatment of low back pain in the 1900s. They would often use this to identify bony abnormalities or other serious pathologies. However, surgeons and doctors were already starting to find that exercise and movement was more beneficial than surgery or doing a lot of these exercises. Another thing that changed back then, rather than bed rest after surgery, patients were recommended to complete exercises and get moving, okay, rather than to be sedentary. In 1934, Ernest Codman, who was a surgeon, developed the Codman exercises, which are a series of kind of passive shoulder circles that are still commonly recommended after surgery. In 1945, Dr. Delorme developed PREs, which are progressive resistive exercises, a form of exercise that we still use today. He developed these after his own knee surgery. And in 1953, Dr. Williams and Dr. McKenzie developed different types of back exercises to relieve different types of vertebral disc injuries. So Williams focused more on flexion type of exercises, and McKenzie focused on more extension type of exercises. So I've included here a couple of images. So this is a Hubbard tank, so you can see that it's a very large metal tank where patients could be fully submerged in water to complete exercises. This is actually an example of a Codman exercise, so someone passively moves the shoulder around. This was just to demonstrate our Williams flexion exercises compared to our McKenzie extension types of exercises. So your final project for the history of physical therapy is going to be your group presentation, and it will be very exciting to see you all present.